It's Uvalde Radio. I'm Robert Miguel, and I'm in the office of one Mr. Dr. Shawn Ragbir. Hello.
Hi.
How are you? Hey, all right. It is so cool to be here. I've never been in your office before. And it's not an appointment. I'm not in trouble that I know of. But yeah, so here we are in your office. Now, Dr. Shawn Ragbir, you are the cardiologist. What's your exact title?
Yes, so you nailed it. I'm the staff cardiologist here at Cardiology Clinic in Uvalde. We are a San Antonio-based group, but we have a full-time operation here in Uvalde, and this is my fourth and hopefully fourth of many years to come here, many decades to come. It's a pleasure to be in the area and a pleasure to serve this wonderful community of people.
Now, Sammy's also here. Sammy handles all this, kind of helps get these things together. How you doing, Sammy?
I'm doing great, thank you.
Yeah, we've got a lot of cool stuff to talk about, and there is Walk with a Doc is happening again, which we've talked about before, but we'll give all the details on that, and then I guess some informational meetings. So let's get, well, first of all, you mentioned 4 years here in the Uvalde area serving our cardiology patients.
Yes,
give us your background. You know, how'd you get in the medical field, and what inspired you, and what led you here to Uvalde?
So funny thing, near tragedy almost inspired my path into medicine. My mom got really sick in probably 1987, 88. She almost died of meningitis, and as a young child, I held the physicians that took care of her as heroes, and I, wanted to be able to do something similar to that or be in that capacity for other people, other folks. And so the trail started there. I got a phone call after graduating from cardiology training. Hey, I had always, I'd done my residency in Texas. I'd always wanted to come back to Texas. I love it here. And got a call from somebody who needed services in San Antonio, and they invited me to come to Uvalde, and that's all she wrote. I came here, fell in love with the people, had a lovely meeting with our CEO and our hospital staff, met a lot of the attending physicians, our PR group, everybody. You just feel the love, and you feel the patient-centric focus here. Patients truly come first, especially in an era where sometimes that focus is lost. And I love it here. It's a pleasure and it's an honor to serve all of you people listening today, and I'm happy to be here.
You started off with the story about your mom. I mean, imagine, I've never really thought about this before, but being a physician must be, there's got to be a certain amount of heartbreak that you guys encounter on the regular, but probably some really beautiful moments of, of health and healing.
Yeah.
What's that like?
It's like you said, I think you hit on the nail, Robert. It's awe-inspiring and it's heartbreaking at the same time. One thing that I'd always wanted in the practice when I was, training in medicine is to develop these long-term relationships, because you see these long-term relationships flourish. You get to know your patients for years. You get to know their aunts or uncles or cousins or nieces, nephews, etc. And you grow with them. You learn you learn about your mistakes with them. They're very honest with you, and I'm happy to say I have several patients whom we share that relationship with. It's like another family here. Mm-hmm. It truly is like another family, and here at Uvalde Memorial, we're blessed that we have the cutting edge technology and the availability of these great resources, but we do it with a healing hand and a healing touch, and you'll see that in all the employees that work in our facility.
Well, everybody is fantastic. Everybody that I've ever encountered within, the medical fields here at Uvalde Memorial and related companies. So, congratulations, and just we thank you so much for serving our community in that way. I guess let's get into the events that we got planned here. You've got this heart to heart. So it's kind of like, it's kind of a Valentine's theme. Heart to Heart also implies that there's going to be a serious discussion about something that matters, right? So let's get into that event.
So February is traditionally American Heart Month. The American Heart Association is proud. It's pleased to present American Heart Month. So UMH, I was honored a couple of years ago to start giving these talks about heart health. And so we have 4 topics of many that we can discuss. So we've got a few here that I can tell you a little bit about. So women in cardiovascular disease, it's kind of I wouldn't say neglected, but it's something we don't pay as much attention to. We think of men, the typical risk factors, the typical presentation that gets hammered into our heads, but we also need to think about women because they can present atypically, and in the past it had been kind of overlooked in terms of cardiovascular health. And obviously there are a lot of things that we need to consider differently in terms of preventative medicine and secondary prevention after a heart attack, after a stroke, etc. The second topic is what's called microvascular heart disease. So, you have friends or family, I'm sure, who may have had stents or heart attacks or interventions, and you think about people getting, these going into the hospital and getting these big procedures done. But the one often minimized topic is the smaller blood vessels. So blood vessels come in a variety of shapes and sizes, and we take care of the big vessels, we need to take care of the small ones too, because they can be susceptible to some of the same disease processes. So we put a highlight on that. Number 3, there's this concept of the broken heart syndrome, and that is a topic in which we discuss people when they undergo traumatic events. They'll feel like they literally had a heart attack, and it's literally almost like a heart attack.
Kind of like you hear in the stories where maybe a long-time couple and one of them passes away and then the other one kind of gives up shortly thereafter. Correct. Kind of that whole... So there's some science behind that, I guess?
There's definitely science behind that. It's what we call a stress-related event or stress-related cardiomyopathy. So we'll touch on that and go into the pathophysiology of that. Something that really opened my eyes during training when I got a lot of exposure to it.
Wow, that sounds really interesting. Yeah.
Yes. So, and the last topic of my discussion is the baby aspirin. So, aspirinidate, does it really keep the doctor away? Is it as good as an apple? Probably not. Apple's definitely tastier than a baby aspirin, to be sure. We've gotten some evidence that has been published by some of our colleagues in the academic centers, telling us when we exactly need to have our patients on baby aspirin. Do I need to take it every day if I have diabetes, if I don't have diabetes, if I have high cholesterol? So we'll touch into that, and we'll talk about when a baby aspirin is indicated, for you, depending upon, of course, every individual or patient-centric focus.
Because sometimes you just hear, take an aspirin, it's going to be better for you, but that's not necessarily true. There's certain places where it's appropriate and other places where it's not. So it's going to be great information there. Give us a date on that again.
So that is going to be next Tuesday, a week from today, February 11th, at El Progreso Library, and everything gets going around 5:30.
Yep. 5:30 to 7. We have free screenings, both blood pressure and A1C checks. We'll also have light refreshments, some fun giveaways. We have 2 other physicians that will be in the room discussing some heart health, Dr. Stipko and Dr. Baber. And also our cardiac rehab team from UMH Rehabilitation. They will also be in attendance as well. So, again, it's free and open to the public, so we hope you join us.
So Dr. Ragbir, let's talk about Dr. Stipko and Baber.
Yeah.
They're your colleagues, your buddies. You guys go golfing. What's up? what do the cardiologists in Uvalde do together?
I wish we did more together, actually. Dr. Baber and Dr. Stipko are valued, highly treasured members of our faculty here. Dr. Baber is a local dentist with Uvalde Dental Associates. Dr. Stipko is our wound care physician, and he's been doing this for a long time. We have a lot of mutual patients because we both see vascular disease and different manifestations. So, we think about the heart. We know it's heart-to-heart month. Dr. Baber's a dentist. Dr. Stipko treats wounds. But, when you think of cardiovascular, so I like to think of the heart as the cardiovascular system. So they represent that a little snippet of that vascular portion. Mm-hmm. Obviously, blood flow goes to your teeth. If you don't have good heart health or if you don't have good oral health, it increases your risk of having heart problems. Mm-hmm. If you don't take care of your wounds, or if you have diabetes and you don't take care of your skin, that can lead to vascular problems or vice versa. So, truly the cardiovascular system is a holistic organ system, and so we rely upon our colleagues to kind of catch other things and focus on other things. So Dr. Baber and Dr. Stipko, we're honored to have them to discuss their areas of specialty and how they relate to good heart health.
Well, it's really cool that you guys are all kind of networking and making, doing these presentations together. Mm-hmm. I think that, in some business, and thank God not here, but sometimes the left hand doesn't know what the right hand's doing, and it seems like you guys are very, very much committed to being cohesive, working
Indeed.
together. Yeah,
and that commitment spreads all throughout UMH, and you'll see that from our hospitalists to our nurses to our PT staff, our therapists, everybody. Everybody's in constant connection with each other, and we owe a lot to our Sammy and her team for getting us out there, getting us in the public, and obviously you yourself. It's a team, and taking care of patients and taking care of ourselves is indeed a team effort. Not any single person can do it alone by themselves.
We'll get everybody to make plans. The event is going to be Tuesday, February 11th at the El Progreso Memorial Library. Heart to heart, get some good first-hand information from Dr. Shawn Ragbir here, your cardiologist serving Uvalde. Again, we're in his office right now. Sammy's also here. Let's go ahead and get into Walk with the Doc. That's coming up on Saturday, which is what, the 15th?
The 15th.
Day after Valentine's Day, right? So we're going to get together at Uvalde Memorial Park.
That's right.
Was it, what, 8, 9 o'clock in the morning? What time is that?
9 o'clock.
From 9 to 10, and what can we expect if we get involved in Walk with the Doc?
That's a good question, Robert. We've done this. We've had the pleasure of doing this a few times already in the last few years since I've been here. Basically, it's an opportunity to get to meet me and my team and some folks from the hospital and see what we do outside of the office. We do realize that coming into a physician's office can be an intimidating and often anxiety-provoking experience for many of us, including myself as a patient. So it's a good idea and opportunity to speak to me and the team outside of the hospital, outside of those confines, and in an anxiety-free environment. Spend some time, hang out. We'll get some steps in, maybe not 10,000, but right. We'll get a couple thousand in and just hang out and participate, answer some basic questions you might have. Now, obviously, any formal questions I would probably direct to an appointment, but if we have some basic stuff, we can certainly address it. I think Sammy can address this better than me, but I think we also have some folks coming from our local gyms.
That's right, yeah.
We did this last year, and it was a huge hit, so we invited some of our local gyms back. Big Oak CrossFit, Pure Fitness, M16, and Shotgun CrossFit will all be in attendance. They'll be demonstrating some warm-up and cool-down, as well as some exercises that you can do at home throughout the walk. So that'll be really good. Again, this event's free, open to the public, and we'll have some fun giveaways at this event as well.
And again, that's going to be Saturday, February 15th, 9 a.m. at Uvalde Memorial Park from 9 to 10, right?
Yes.
Yeah, so, and I was able to attend one of your Walk the Doc, and that was a lot of fun. It was good information, got a little networking, got to hang out, and the walk was not too bad. It was, I'm way out of shape, but I survived, so I'm still here to talk about it. So,
well, actually, you did very well, Robert. I think you brought your dog.
Yeah, we brought our dog. That'll keep you going. Our dog really needs to be trained.
Yeah, I think the weather will be nice. We got a little bit of a cool snap coming our way in the next couple of days, but I think the weather is going to be perfect for a little bit of a brisk walk in the morning. Just bring a jacket or a layer up, and we'll have some fun for an hour or so.
Well, it's been great getting some information from you firsthand here. Again, Dr. Shawn Ragbir, give us some information about how we can contact you at the office or make an appointment if that's something we need to do.
So our clinic is on the Uvalde Memorial Hospital campus. We're in the line-shaped clinic building. It's near all the construction that you'll see going up for our new hospital. We're in Suite 400. Our phone number is 830-278-1652.
Okay.
And fax is 830-278-3654.
All right, so come on over here and get your heart checked out. It's heart month, right? February. Right. So and Valentine's, you want the heart working, especially if you're loving somebody with it. So, Sammy, anything else we got to get out there?
I think that Dr. Ragbir covered it all.
Okay. All right. So again, that's going to be Tuesday at the library, Saturday in the park. Details go to Uvalde Memorial Hospital website, right? I guess would be good.
Yes, you can visit our website umhtx.org, or you have all of our events on our Facebook page. So any details that you need will be right there.
All right. Well, Doctor, thank you so much. Sammy, thank you again. And that's going to wrap it up here with Uvalde Memorial Hospital on Uvalde Radio.